A system meant to heal, twisted by greed, this is healthcare corruption. It is the misuse of public or private funds and resources within the healthcare sector for personal gain. This can manifest in various forms, such as bribery, fraud, or embezzlement of funds meant for essential medical supplies or services. It's not just numbers, it's stolen medicine, delayed treatments, and lives put at risk.
Corruption in healthcare isn't just about bad actors. It's about the systems that allow it to thrive. We have identified 5 key drivers. First, low pay and poor conditions. When wages are inadequate, workers may seek extra income through bribes just to survive. Second, weak enforcement. Without proper regulation and punishment, corrupt activities continue without fear of consequence. Third, high demand and limited supply. Shortages push desperate patients to pay extra for faster life-saving service. Fourth, profit-maximizing systems. Hospitals may overcharge or recommend unnecessary treatments just to boost revenue. And finally, lack of transparency. False reports and hidden expenses are easily concealed when no one is watching. Understanding these roots is the first step toward a cleaner, fairer system for everyone. Transparency is the only cure.
Now I will talk about the effects of healthcare corruption. First, the impact on patients. Healthcare corruption can seriously harm patients. When doctors or hospitals accept bribes, some patients may get faster or better treatment while others are ignored. This creates unfair treatment. Also, corruption can lead to wrong diagnoses or fake medical reports. For example, a patient might be given unnecessary treatments just to make more money, or low-quality medicine may be used to reduce costs. This puts patients' health and even their lives at risk. Second, the impact on society. Healthcare corruption reduces trust in the healthcare system. When people feel that hospitals are not fair or honest, they lose confidence in doctors and medical institutions. It also increases inequality. Rich people may be able to pay bribes and get better care, while poor people suffer and may not receive proper treatment. In addition, corruption wastes resources. Money that should be used to improve hospitals and services is lost, which affects the whole community. In conclusion, healthcare corruption does not only affect individuals, but it harms society as a whole by creating unfairness, risks, and loss of trust.
Healthcare corruption is not just a system failure. It has real consequences for real people. It raises costs, limits access to care, and can even cost lives. When resources are misused or decisions are driven by personal gain, patients, especially the most vulnerable, are the ones who suffer. Addressing this issue requires more than awareness. It calls for stronger accountability, greater transparency, and a clear commitment to ethical practices at every level of the healthcare system. Because healthcare is not a privilege, it is a basic right, and protecting that right means confronting corruption directly, consistently, and without compromise.